Absolutely. I mean, I think they are so undervalued.
Hmm.
This is a very skilled army, which is bigger than the healthcare workforce. We are looking after more people day to day,
Hmm.
and yet we don't get any of the same recognition. So these people with outstanding qualities
Right.
to come and work with vulnerable elderly people and give them the best that they can at the autumn of their lives.
Yeah, I went to a home recently, Nadra. It was called Sidmar Lodge. I'm going to give them a shout out, where my grandma was for a short period of time. And, there was carers of every single background and age who were working there for, not a lot of money. When I spoke to each and every one of them, they said that they had a mission and purpose to gift the last moments of these people's lives the dignity and all of the possible richness and joy that these human beings were entitled to. And there was one moment, Nadja, I'll share with you, where um, somebody brought some music in, and there were people with various differing states of dementia, and all of a sudden that whole community, including all the carers, started dancing along with the residents in that place. And I have to say, and I'm not embarrassed to share this with you, Nadra, that it moved me to tears, just how much these people come to work. They have a sense of mission, purpose. They were there in the most dangerous times, very often risking their life. In fact, in many cases, losing their lives to COVID. And yet we forgot them pretty much in the course of the horror of the last 18 months. So before moving to this thorny issue, I just wanted us to really talk about and reflect and give them the round of applause that they didn't get.
Absolutely. And I mean, if I can share, just my aunt passed away in the middle of COVID. We couldn't go and visit her.
I'm so sorry.
And it was just one of those moments where the care home staff, well, you can come in or we can bring her down
Mm.
from a second floor. And I said no. And they asked me what they could do. And we're practicing Muslims. My aunt was a very devout Muslim. And I
Hmm.
said, if you can find an iPad
Hmm.
or anything and just put the Quran on
Hmm.
close to her,
Yeah,
that would really bring peace to us.
yeah.
And they did it immediately. They only had one iPad in that care home.
Oh,
They found it and they went and did that. And they said they could visibly see my aunt's face moving
oh.
to the sound of the Quran playing. So they
Nadja,
have gone
Nadja, you're a leader.
beyond.
I'm sorry to interrupt you. I just these we forget these human stories. I don't know whether the carers in that home were of the Muslim faith. Perhaps they were, perhaps they weren't. The home I visited, they were from every single faith background.
Yes,
But that
yeah, they were
story,
from every single
right?
faith. Yeah.
That's that when you hear that and know that they honoured what your aunt needed in her last moments, even though you couldn't be alongside her. In your role as a leader of the chair of the National Care Association, just on a personal level, what does that do to you?
Well, I think it's really emotional. It's very emotional because all through this, I've been obviously, stating the case for the sector, but personally, I have seen the difference it makes because my mother was in a care home, my uncle was in a care home, and I think it's a tripartite relationship, care services. It's about the individual, it's about the staff, and it's about the family coming together to do the best that we can. And you find that sort of service and you find people who are committed to that role, and their ultimate aim is to do the very best they can for that individual.
Mm-hmm.
That's our aim too. And if we can work together, then we bring about those moments that you've just talked about and I've lived through too.
Mm-hmm. Now, one of the issues, knowing how great the overwhelming majority of our care staff are, some of them don't want to be vaccinated. They might have a variety of reasons for that. I personally don't think any of those reasons are valid, but does that mean they shouldn't be able to work in our care homes, Nadra?
Well, I think the problem we have here is, Rob, that they have worked through COVID without vaccine and they've kept people safe. Now, we absolutely understand that vaccination is key to an individual's well-being. So when you take the vaccine, you're protecting yourself and by thereby protecting others that are around you. But there are people who, for for various reasons, are actually very, very affected by the vaccine. They feel they don't know enough about it. They've never had vaccines in their life. They never took the flu vaccine. And they feel being compelled to do that, and being the only group that's being compelled to do that. So care homes are the only ones. Healthcare assistants working, healthcare staff working in hospitals don't have to do that. Home care workers don't have to be vaccinated. It's just care homes.
I mean, the argument, which I'm confident you're aware of, is that this is, without question, the highest risk category in terms of mortality for COVID, right? And you use the word tripartite, or whatever that word is. It's not your fault, Nadra. I just like plain speaking, but it really is important. What we're talking about here is people will die if they get COVID. It's as simple as that. It's not about morbidity. These are like those numbers, or people expiring. These are, my granddad, your aunt, your parents. And whilst there is a high risk factor, and whilst we know that the science tells us that this vaccination is likely to reduce considerably that risk, it seems to me that isn't this just a sort of straightforward common sense issue, not a freedom issue?
Well, I think if common sense was playing a part in this, it would be slightly different, because we can take somebody out of our care home, which could be fully vaccinated staff. And if they needed hospital treatment, they would be taken into an NHS setting where people are not vaccinated, and they would still be highly vulnerable, as everybody in a hospital setting is. They're highly vulnerable. So I think the challenge we now have is we have staff moving away from our services. So we've got a chronic shortage of staff.
Right.
We have, at any given time, we have around 120,000 vacancies. People will leave our services and they will go and work in the NHS. So is that right? Or they will go and look after people in their own homes who are also vulnerable.
Although lots of people in their own homes, Nadra, are demanding or asking that care staff are double vaccinated before any employment is agreed. Should that be unlawful too?
Well, I think it's no, of course not. I think in care homes we're getting families are asking, and actually some are saying that we only want somebody who's doubly vaccinated to be looking after our mum, and care providers are trying to comply with that. But we cannot force people to have the vaccine. It's going to be a condition of employment. If you choose not to have that vaccination, you now are choosing not to be in that career. And that's where we are at this moment in time, which is really challenging for us as a sector, because we've got to continue to provide that. But we cannot force people to have the vaccination. It's a choice that they have to make. But we are losing people who've worked in care settings, really experienced for 10, 12, 14 years. We've got senior staff actually saying we're not going to have it, and they're going to leave.
Well, I mean, I don't know about the numbers we're talking about. No doubt, this is a new phenomenon, so you'll get them in due course. But, it seems to me there comes a time, and I'm going to repeat this, where it's sort of a common sense issue. I hear what you say about the NHS. I don't know whether that policy is going to change moving forward. But given care homes are vectors not just of contagion, given how those communities of the elderly live, but in all likelihood, if that virus is brought in to a home, it is without any question straightforward lethal to the grandmas and great granddads and that great generation. I mean, is it really asking much to say it's a precondition of employment? Bearing in mind the absence of proof of danger of these vaccines. I know that the switchboard is going to explode now, but that is the science, right?
I mean, it is, but we also saved many, many lives through COVID where we had infections. So, infection control is, so having the vaccination, we didn't have the vaccination. Actually, at one point we didn't have PPE, but we have saved many, many lives through very good infection control. I'm not arguing the point that vaccinations should be part of everybody's armory when they're fighting.
But Nadra, can I ask you a question? So forgive me, would you want somebody who was unvaccinated looking after your family member?
My father's PA has looked after my dad throughout. She's from Romania and didn't want to have the vaccine.
So the answer to that is yes. I have to say that I wouldn't. I'd be desperately worried, as many people would. Nadra Ahmed, last question. Moving forward, What would you say to the carers who have been out there that have been unthanked? This is an opportunity to move it from a discussion about COVID to the millions of people that are, well, that are listening to us today, that will be reflecting on the elderly in homes and have had people that have cared for their loved ones in really desperate times. Just in a nutshell, what would you say to our carers?
I would just like to thank them. This nation owes you an enormous debt of gratitude, and it needs to be recognised. You are highly skilled individuals who have actually spent your entire time throughout this very difficult period and before to care for people in the moments when they most needed them. And we owe you a huge debt of gratitude.
Well, we may not agree on vaccinations in care homes, but we certainly agree on every word of that. Thank you to our
I
great
don't
carers.
disagree with vaccinations in care homes.
We just did, Nadra, but that's by the by. The most important thing is we want to stand up, celebrate and clap at our carers.